Doctors are warning of a little-known virus that causes many of the same symptoms as flu and COVID. It's called HMPV. Some of those common symptoms include a lower lung infection, a cough, runny nose, sore throat, and fever. But unlike COVID and the flu, there's no vaccine or antiviral drugs to treat HMPV. For more on this and also a couple of other medical topics, we are joined by our medical contributor, ER doc, Dr. Michael Daignault. Thank you so much. You brought this up to us, the concern about HMPV. It has a much longer medical name. You can say it, not me. How concerned should we be?
So human metapneumovirus is likely the most important virus that you don't know about. And so it's been around since 2001. It causes a lot of the same symptoms as COVID and flu, as you mentioned. And I think, we saw a surge over the winter months leading up to March, and that was consistent with surges in RSV and flu, all these viruses that were suppressed by public health measures and viral interference in COVID over the last few years. So fortunately, the good news is that although in the very young and the elderly and immune compromised, it can cause severe disease like pneumonia, for the most part, for the rest of us, just going to cause a very nasty cold.
Okay, so you just got to work your way through it then.
Yeah, and I think one of the interesting things to know is that it's a cousin of RSV, and as we know, we have those new RSV vaccines that were just approved by the FDA for adults. And so a lot of the same pharmaceutical companies are working on a vaccine that covers both RSV and human metapneumovirus, so that would be really important to help us get through those winter months.
Okay, and then my last follow-up on that one is, are you still seeing HMPV right now in the ER?
So we weren't really testing for it through the winter, and a lot of times patients come in and we would test for COVID, they would test at home and it would be negative, and it was very confusing, and so we always assumed that maybe the test just didn't pick it up. So a lot of those cases were probably human metapneumovirus. Okay,
our next topic is about COVID immunity. So speaking a little bit more about that, more than 3 years into the pandemic, I think we have some video to show our folks at home so they don't have to stare at us. An overwhelming majority of Americans have some level of COVID-19 antibodies. This is according to the CDC. Researchers found 96% of Americans 16 and older have some level of immunity. This is significant. Why?
So I think one of the most important things that came out of the studies was that almost 50% of Americans have hybrid immunity, which means combined immunity from both vaccination and infection. And the reason why that's important is because when you have hybrid immunity, it can respond to these ever-evolving variants that come into play and still provide robust protection. The other important thing from the study was that in those over 65, there was very little rates of immunity from infection, which means we did a great job at vaccinating those over 65. The immunity that they have was primarily from the vaccine. So I think the CDC will take this into account in the next couple weeks when they make the decision over what is going to be involved in the vaccine for the fall.
That's right.
And who should get it.
Right, because we're going to potentially have it as an annual shot, just like the flu. Okay, we'll keep a watch on that. Melatonin, something weird is going on with melatonin. That is literally the title of an article that ran in The Atlantic this week. It's referring to new findings that pediatric overdoses have increased by 530% over the past decade of melatonin. You brought this to our attention. This is striking. Why is this happening? What's going on?
So my concern with melatonin is that the FDA regulates melatonin as a supplement, and supplements are regulated as food items, not medication. And melatonin is a very complex, complicated hormone that is regulated by a complex feedback mechanism in our brain. And so that's the #1 thing, that melatonin should be considered a medication like all the other medications, not a food item or a supplement. The other concern is because there's not a high degree of regulatory involvement from the FDA in melatonin, we don't really know if the doses are accurate. A lot of these medications or supplements are over-the-counter. Parents are picking them up for themselves or for their children, have difficulty sleeping, and they don't know how much melatonin they're actually getting or how accurate that label is. And so that's why we're seeing kids coming to the ER with a lot more overdoses. And it became a popular supplement for not only children, but for adults over COVID, when a lot of us were struggling with anxiety from the pandemic and difficulty sleeping, too.
Right, and those symptoms, when you say overdose, it's nausea, vomiting sort of a thing? It's
nausea, vomiting, and and just extreme sleepiness. And so the nausea and the vomiting is a little weird because that's not really a known adverse effect of melatonin. So there's something else going on in these supplements, whether it's dysregulated amounts of melatonin or the other substances that are within these gummies or supplements that we just don't know about. So we need more regulation with the melatonin supplements for sure.
Okay, as always, we appreciate you so much, Dr. Michael Daignault. Thanks so much. Have a great weekend.
Thank you too.